Fanny here. Um, I wanted to jump back on and say thank you. I did get some great emails with some feedback on my video, and I wanted to thank you guys for that. Um, if you didn't watch my intro, you probably want to just so that you understand what I'm talking about. But this is my second video, and Bonnie here is just my company. This is for therapy purposes. I am not a licensed nail technician or nail artist, not a psychiatrist or a doctor of any sort, and don't tend to. What I will be sharing today is life on Lexapro and the other antidepressant medication that I am on to help manage my PTSD, generalized anxiety symptoms. So, with that being said, I'm going to dive in that and start sharing. Before that, I will try and keep this video as short as possible just because some of the feedback that you guys kindly shared, or friends who watched my video were kind enough to kind of, suggest to keep my videos a bit short so that I can help with like managing the organization of my video and not jumping back and forth on certain topics, or kind of getting lost there and losing track. So I'm gonna do that. And like I said in my first video, I like to do an activity. I will either be doing Bonnie's nails or doing a puzzle or building some Lego, although I've kind of done all my Lego builds. My sister got me into their botanical collection. Shout out to all those out there who build Legos. It's expensive, you guys. It's an expensive hobby. So the nail hobby here is a lot more cheaper, and it's actually more challenging than building Legos because I am not a licensed or trained nail artist or technician. I just kind of learned on my own. I watched my sister do my nails. She did courses and that kind of thing, but then she started doing my nails. I really haven't paid to get my nails done in a very long time. Not that I am cheap or anything, but me and my sisters are very picky about our nail shaping. I'm more of like the, coffin, stiletto kind of gal, and I think my sisters are too. But for whatever reason, I never walked out content from the beauty place with, the perfect nail. I'd always struggle. There's this place here close by my home, one of the joining cities, who they do a fairly good job. And I go there maybe once or twice a year when I go on vacation and I want to treat myself to some vacation nails, and I want like, something really nice done, a really nice design that'll, be hard for myself to do, or I don't want to bother my sister. So those are the only times that I will probably go and pay to get my nails done. Otherwise, I do my own nails and I do a fairly good job, you guys. I mean, these are 3 weeks in and right now I've pretty much filed them off from like natural, wear and tear, just doing normal life stuff. And I'm not sure what I want to do next. This was like a little soft early February Valentine, late January, early February Valentine sort of design with some little purple and like foil design there, and so some little gems that I added as well. But anyways, enough of nails. You'll see as we kind of go through this journey together and, work on Bonnie's. You can leave comments if you want. Please don't come after me. Like I said, I'm not a professional. I don't want to be one. I'm just, doing some therapy here. So, my medication. I am on Lexapro. I'm on 30 milligrams of the Lexapro, and I want to say my psychiatrist who manages my medication said that 30 milligrams is where it's normally capped. I could be wrong. I know she said some people go higher, but there is certain circumstances. I didn't really ask very much just because that wasn't going to be an option for me. And when I started taking antidepressants, like I said in my previous video, I was suffering from major PTSD, anxiety, generalized anxiety symptoms that included heart palpitations, brain zaps. I had a lot of numbing and tingling throughout my body, a lot of anxiety, a lot of worried, intrusive thoughts, fear, lightheadedness, vertigo-like symptoms. I could not sleep for weeks at a time. Geez, you guys, I mean, I can go on. My symptoms were just awful, awful. I mean, like I said, I was at a point where I didn't want to leave my bedroom. I was just hiding, isolating myself. I was miserable. I just wanted to die. I didn't think that I would be able to overcome this and bring myself to a stable place mentally and emotionally to be able to handle life. I couldn't tolerate any sort of conflict. I had to build the courage to be able to speak to my husband and tell him how bad I was going through this, what I called battling my brain being on fire. And just being so honest with him to the point where it's like, I can't afford for us to have any sort of argument. And that wasn't just my husband. It was just like with everything in general. I would avoid any type of conflict, anything that would shake me up in any shape or form, mentally or emotionally. I was tapped out, you guys, and it was a very scary situation. After a year of that and battling with that and trying to find natural ways to fight that and heal, it just wasn't happening. And I was just getting worse, and my isolation was just getting more and more to be a daily thing and not just, on certain days or hours of the day. I was pretty much just not wanting to engage with anyone, and I was just so miserable, and I was afraid and just beginning to shut away from everything around me. And so that brought a lot of more fear and anguish, I would say. I was scared for myself. I didn't know what else could happen that would make things a lot far worse. So I finally reached out to the psychiatry department, and my doctor had mentioned previously that she thought I was having panic attacks and anxiety and stress and all these things, but I had not spoken to a psychiatrist at that point. It was just really my physician, my primary, just kind of coming to terms based on my symptoms and, just hearing me out. So I was referred to psychiatry and I went under an evaluation, like a deep evaluation. And it, sure enough, it came back with, it was very thorough. I mean, I think I spent like maybe 2 or 3 hours talking to her. And I mean, this thing was just not, understanding what was going on currently, but just things from my childhood starting to pop up as well that sort of, play a role in my diagnosis. So I remember saying, like, I can no longer have a normal day. I don't even know what normal is anymore. And I can't really do any of my daily activities, my work, taking care of my home, my husband, our rescued dog, myself. I just couldn't handle anything. So before that, I mentioned that I had had surgery and I was given this medication that is also used for it's an antidepressant that kind of does like a dual function. It targets pain, anxiety, and prior to my psychiatrist, I had gone to the pain management department because I had what I feel was an unsuccessful surgery for my endometriosis, and I had so much pain. And this pain management doctor knew about my anxiety because I was spilling my guts out to every medical professional that I was seeing at that time. I was seeing a handful of specialists that, were in the gynecology department, my primary, general surgery, and so on and so forth. And so I was just advocating for myself just largely through all those departments that I had seen in the last, year, during, the course of like the day of my surgery and post-surgery. And I was telling everyone, like, this is what I'm experiencing, this is what's going on post-surgery. These are pretty much the negative results of my surgery and the impact and the toll that it's taken on me, because not only I feel I wasn't successful at, fighting endometriosis, and the pain that was associated with that. I felt like I opened a can of worms to going under anesthesia and waking up to face what I thought was a bigger problem than my endometriosis, dealing with my mental and emotional health. So ironic, you guys. I mean, at that moment, I regret it so much, and I'm very I still have a lot of conflict with how I feel about that, because had I not had that surgery, I don't know if my body would have waited longer to spill out all of this emotional trauma or not, or it would have taken more time. I'm not sure. And I don't know if I'll ever be sure, but I have a lot of conflict with how I feel about that, whether it was the right decision to have that surgery or if I truly regret it, right? Because I'm left with, like I said, an open Pandora of all of these things that spilled out from my childhood, a trauma that was screaming out of my body through these symptoms that were very scary. So I'm not sure. I'm not sure if I regret it or not, but I do know that going under was definitely a big factor in making it happen sooner than I had to. And I think that the universe is never wrong and things happen for a reason. I think that I was being pushed to grow to that next level in my life and finally face, I guess my demons, or, a lot of people call it that, or face, the things that we, you know, hide, that we store in our bodies, in our souls, in our hearts, in our mind. And it was time to face them. It was time to face so many things. And that is the way my body was asking me to do it. So I ended up accepting the help. And this gynecology pain management doctor said, hey, so I see that you're experiencing stress, anxiety, and PTSD. I was very ignorant at the time, and I didn't realize that, I don't think it's ever appropriate for any doctor outside of their specialty to make recommendations for something they're not very familiar with. But this gal was very sweet, and I know that when she prescribed this medication, she only meant to help me get some relief, because I was sobbing at her doctor's office, and I was just desperate to get some relief. And it wasn't the pain, you guys, it was mostly my mental and emotional pain that I was going through, and the physical symptoms of the PTSD and the anxiety. And she got me prescribed for Cymbalta. I can't remember exactly what the dose was, but I always start very low on any type of medication, just because I'm very sensitive to anything I take. Just to give you an idea, I am on 30 milligrams of Lexapro. It's taken 2 years this past year to get fully maxed out. I started breaking a 5 milligram pill of Lexapro in 4s. So I was doing 1 point something, and I did that for months before I even went to, anything higher than 5. So that's to give you an idea of how sensitive I am. In any event, she prescribed Cymbalta because that would help with pain, and that would help with my stress and anxiety, according, to this doctor. And you guys, oh my God, I took that first dose on, I think it was on a Monday, I can't forget. No, on a Sunday night. I was going to work on Monday, and that thing was scary. I don't know if it made me manic for a few hours or whatnot, but not only it woke me up, it was, I don't wish this upon anyone, but mentally it was scary. It was a very crazy and scary experience getting on that medication. I had called the advice nurse. I was going to go to the ER, but I called the advice nurse because of the symptoms that I was getting. They were not okay. So I immediately called the advice nurse, and they said, okay, calm down, take a Benadryl, you're going to be fine. You're highly sensitive to this medication. It seems like it's actually, now they put it on my chart as, a medication that I'm allergic to, or, so, I don't ever want to have that. But pretty much, it made my symptoms like 100 times worse, and some it was very wild. and scary. So that was Cymbalta. Definitely not something for me, but I know it works for some people and it does amazing. It's amazing for some people, but others, like myself, probably not a good choice of a treatment. So again, I am not a psychiatrist, I'm not a doctor. I am just sharing my experience with Cymbalta and moving forward with Lexapro. I got in contact with a psychiatrist at the doctor's office, and I was evaluated, and I discussed all of my prior issues with medications. That one especially, I had been on Prozac about 15, 20 years before, and I remember not very much anything negative, but I was under depression then, and I was fine. So we discussed that, but it didn't seem appropriate for the type of symptoms that I was experiencing with the PTSD. So it seemed like Lexapro was going to be maybe the least harsh on my body according to the assessment, and the one that's going to be a bit more easy for me to handle given my experience with the Cymbalta. And the one that was, recommended to treat the type of anxiety symptoms that I was experiencing and the PTSD. So I want to say it took about 6 to 8 weeks. I think that's what it generally takes before you can actually start to see changes, and whether it's working or not. And you guys, I mean, I didn't think I would be able to smile again before taking the Lexapro. I didn't think that I would be able. I'm like a very witty person. I like to believe that I'm very funny and just that person, that is just breaking the ice for people and just making the environment just fun and, just bubbly and, and I had lost that. I had no interest in that. And when I started to engage again and feel like myself again, I mean, God, I felt such a relief. It's hard not to, feel this knot in my throat from getting, melancholic about it. I've talked so much about this on, with during therapy, which now I'm able to sort of, handle my emotions differently. But before I couldn't really talk about it without breaking down and just, man, going through those emotions of just thinking back how we take for granted our health, our physical, our emotional, and our mental health until you lose it and you regain it with such more strength and from a different place. Because now when I think about my health and my emotional health and my mental health, gosh, I guard it with all my life. I protect it. I have boundaries on so many things surrounding my health. And it's not until you lose it and you get it back that you realize how important it is, because I had so many mornings and nights that I was miserable. I just couldn't care less for just being alive, because I said, well, what is the point of being alive if I am struggling, if I am not healthy, if I feel like I am dying, like I feel like I am dead inside, mentally, emotionally, but I still have this body that's awake, but I'm I am just, I don't want to say the word numb because I was feeling so many things, but just, you know, living miserable, not living a the life that I was intended to live. So now that I am so much more healthier and in a better place, I don't take it for granted. I'm just so happy that I was able to get the help that I got. And 2 years later, still on Lexapro, still get very, very mild symptoms, but I can control them after doing therapy, EMDR, and just, working on things from my past and my childhood. Um, I feel that I can handle life a lot better. And I appreciate, and I mean, every day, even though I probably don't say it out loud or to myself, I have that feeling of gratitude of being here today and sharing my story and letting people know that there is light at the end of the tunnel, because I always wanted to find that through therapy. And I remember telling my therapist when we first met, one of the first few times, I said, I just want to feel normal again. I want to feel like myself again. And I didn't realize at that time that I was asking for not the right thing, because feeling like myself again prior to all of my symptoms and all of those scary things I went through, I had so much in me that needed to change. There wasn't going to be what I thought was me feeling normal. What I needed to say at that time was like, I need to unravel and heal everything that needs to be addressed. And I need to make a new normal person for myself. I need to make a new normal feeling life beginning for myself. I was wrong. I did not want to go back, because that would have been miserable too. I had so much in me that needed to be addressed. And I learned that that's not what I wanted. And so it's still a work in progress. I am still working very, very hard to unravel, dig things out, and face them. Have the courage to face them. And understand and accept that life is painful. And there's so many things that are very, very complicated that sometimes we don't have answers to, because I've come to understand that as well. Just starting this journey, being so obsessed with figuring things out, I didn't realize it made things a lot far worse for me, until I decided to stop trying to control, stop trying to be the driver of everything and manipulate everything and control everything all around my life in every area, and sit back and let things, work their way the way they're intended to work out and unfold for my better self. So I am on Lexapro, 30 milligrams. I am doing so much better. I have been, managing my symptoms. I recently got on Buspar just because as I am doing some therapy, and I also just got a second surgery 2 months ago, a hysterectomy. I will share that, a video on that for my endometriosis warrior sisters that I know would like to know my experience with the hysterectomy and how it has helped with my endometriosis. Like I said, my first video, I am stage 4. I'm 1 in 10 endo warrior. Um, I went through obviously the challenge of going through surgery for that, um, prior and post. So that brought on some stress. Obviously, there's life occurrences as well. Just because you're in therapy and you're taking care of yourself or whatever it is that you're doing, meditating, however you connect with yourself and do self-care, we still have to go out and face life, and we're not exempt ever, even though we're on medication, even though we're talking to people or whatever it is, that method that we're using to treat ourselves, we're not exempt. We still have to come across challenges, and we, address trauma, but then we come across new trauma. And so we have to work on ourselves every single day. We have to love and care for ourselves every single day, every single day. And I'm not sure if I was hitting plateau with my Lexapro, because you really just don't know, right? We don't know the brain and what it does, honestly, especially me, because I'm not a professional, right? I just kind of go by what my psychiatrist and my therapist, recommend and what they feel, when they evaluate me. But, there are some things that were a bit challenging, in the last years. So the last 6 months, I've had just like very, very mild increase in, some irritability and other things, with hormonal treatment for my endometriosis. All those things trigger, other things, right? And so I was put on Buspar. I'm taking 15 milligrams. That seems to be very easy on my body. And that just kind of helps me relax. And I am able to just keep calm. I want to say, because I know some people may ask, I don't feel numb at all. I can still feel emotionally, mentally, physically. I don't, even with the Lexapro, I feel pretty normal, you guys. I was afraid that, a lot of people say, they have certain experiences with antidepressants. But for me, I've been very lucky that I have just experienced nothing but just good benefits from it. And that is just really, getting rid or minimizing all of my physical symptoms that I've been experiencing with the anxiety and the PTSD. So, again, that's just how my body has been, taking it. And, the bus part just helps me keep calm. I was on trazodone as well for sleep, but I got off of it just because that made me very sluggish in the morning and groggy. And, I was having nightmares too. I know that some antidepressants or, those sort of things can cause nightmares. So if you do experience those things, you should talk to your psychiatrist about it, just because from my understanding, it's not okay, or I don't want to say normal, but those are just side effects from medication that aren't very, fun to have. And so there are other medications that, your psychiatrist or pain management can sort of look into and make other recommendations. So you guys, with that being said, I hope that this information is helpful, that if you relate, if you're experiencing anything like I was, I hear you, and I'm sending you a big hug and reminding you that there is light at the end of the tunnel, that you can get through this, that you should talk to people. You should talk to your loved ones, especially. In my case, I spoke to my husband. I was very just honest, like communication. Gosh, when people say communication is key, man, communication is key. Communication is everything. It's life. Just even on a regular basis now, I am in the habit of, like, if I'm having a very bad day, I'll tell my husband, like, hey, I'm not feeling good today. I'm like emotionally not feeling good. Like, you know, you don't have to coddle any, attitude or irritability, or take it. But um, it's more so for him to be mindful and aware that I'm not in a good place, and I don't want him to take things that I may say or do personal. So I try to get myself very aware as well, so that I could be very careful and cautious as I go through my day, because you don't want to hurt your loved ones. They're your support system, and communicating with them and letting them know how you feel on a daily basis is very important, because they can uplift you, and they could just, by being aware, if they're experiencing something, if they see that you're maybe defensive or irritable, they can change that, because my husband he has made me feel better during times where I've not felt better, So, don't forget to communicate, talk to someone. If you don't believe in therapy, that's fine. Talk to yourself, have a journal. There's so many things, you guys. I am not advocating or trying to tell people to go do therapy, to go get on any type of medication. For me, it took me over a year to, reach out to professionals and get help. Like I said in my first video, I was trying to tackle this the holistic way, because I've always been very holistic approach with, like, all of my self-care and health and all of that. But unfortunately, my chemical imbalance was just so big that it was very, very hard to overcome this without having medical intervention and medication, you guys, and that's okay. I had to learn to accept that too. I had to learn to be okay with being on medication and not feeling embarrassed or ashamed or afraid. There were so many feelings with that too, you guys, and that's a whole nother topic. But that is my experience. Maybe in the future I will share some things that I've been working on through therapy. Gosh, you guys, I mean, it is so much, it's overwhelming. But I wish you all well. This is a very touchy subject. I am in a vulnerable place right now, without even having to go into details, but just sharing that with you guys. It takes a lot of courage, you guys. It really does, because mental and emotional health, I feel like people panic. People are scared, and to be judged, to be seen in a different perspective. But remember, we're human. We're all human, and we all go through things. And it takes courage to seek help. And if you need it, I encourage you to go and find it. However you can, whatever approach it is, don't let it sit in that closet. Don't let it sit in that closet of your heart, your brain, wherever we store it, in illnesses that we encounter. Don't wait for you to be tapped out like I was to get help. So I'm sending you all of my good vibes and healing, and just hope. We all need hope. And there is hope out there, you guys. Thank you for listening. And I don't know, today I felt just like I wanted to kind of show my face in the camera because I thought that this was a very sensitive topic, and I wanted to kind of give you guys that personal connection. And I'll probably do Bonnie's nails on the next video. Thank you. Have a good night.